Good morning. My name is Elizabeth, and I am a nurse consultant for Citra Healthcare. And my job consists of answering phone calls for our clients, folks that are calling in with a wide variety of symptoms, anything from a new mom with a newborn questioning whether or not this rash is normal, or it may be somebody that's displaying some cardiac symptoms and really needs to go to the emergency room to rule out a heart attack, or they may have stroke symptoms, or they may have been shot or stabbed, or sexually assaulted, or they may be in the middle of a mental health crisis. You just never know when you answer that call what the situation will be. So you always need to be on your A game, always ready for that call. And one particular call that came in was a young woman, and she had had several hours of an extreme headache, 10 out of 10 pain. She was having some dizziness, some weakness, really, really not feeling well. So even though she was young, these symptoms are not something that you would take lightly. So I asked her to sit down, put her feet up, and I said, let's call 911. I said, I'm going to hang up with you, you phone 911, and then I'm going to call you back, and I'll stay on the line with you until help arrives. So I hung up with her and gave her a few minutes, and I called her back. And this time when I reached her, her words were slurring. And I was really concerned because I'm like, all right, this is really emergent. So I'm talking to the woman and I'm trying to, get her to stay with me. I'm like, come on, stay with me, talk to me, help is on the way. I want you to talk to me. And then the phone drops. And what a horrifying feeling when you're the only connection to this person that's having, a very serious event and they've just lost consciousness. Luckily for her, there was a young relative in the home who picked up the phone and, very frantically is like, what do I do? I said, let's check for breathing. He's like, she's not breathing. There's no air, she's not breathing. And I'm not feeling a pulse. So I instructed him on how to do CPR on this young lady and how to do the chest compressions and walked him through it, kept him calm. Well, he was doing chest compressions. She gasped, started breathing, and then went on to have a grand mal seizure during this episode of, I'm not sure what was going on, but during this episode, she then had a grand mal seizure, or a very scary seizure to this gentleman. And then as soon as the seizure ended, she, of course, stopped breathing again. So back to the CPR we went. And what seemed like an eternity, which I'm sure was only a matter of minutes, this man and I kept this lady alive over the phone by instructing him on how to care for her. And then, thankfully, the paramedics arrived, and I was able to say goodbye to this caller. And, of course, your heart's in your throat the entire time this is happening, and you've got to stay calm for this caller because, if you don't stay calm, they're not going to stay calm, and this life is in their hands. So, it's the work that we do as nurse consultants is so important, and it's so invaluable to our callers and to our clients. And I'm just amazed at the acuity of the calls that we take. When I stopped working in the hospital setting and took this position, I thought, well, what a cushy little job. I'm going to sit home, and this is great, kind of early retirement. Sit home and take calls and send them off to the ER. This will be wonderful. But what I've realized is that it's not as easy as one might think. I think the perception of triage nurses or nurse consultants is that of a very cushy job when it's anything but. It is adrenaline pumping, heart racing, critical calls that we're taking, and it's so imperative that we get these calls quickly and that we get these folks to the appropriate level of care and that we keep them safe and alive. And in the year that I've been here, that I'm aware of, because folks have written in or called back and said, you saved my family member's life. And that is such an amazing feeling to know that even though I'm not in the clinical setting, that I'm still affecting and changing lives. So I'm really proud to say that I'm a nurse consultant for Citra Healthcare, and I look forward to many years of saving lives and helping clients over the phones.